An occipital fiber line 3 has always been associated with the meme of being pathology, as in big honkin' tumor. This contradicts Dr. DeJarnette in two ways. The first being his definition of pathology as any deviation from normal function, which is a far cry from big honkin' tumor. Using his definition, conditions such as Hashimoto's, insulin resistance, menstrual or hormone issues, constipation, anemia, pancreas insufficiency, or hypochlorhydria would be considered pathology, as the body loses the ability to compensate for this condition. The second of Dr. DeJarnette's observations is that these conditions are associated with the loss of controlled vertebral movement, resulting in stress hypertrophy at the pedicle lamina junction of the vertebra associated with the organ in distress. This would also include a pars defect, which would also be considered a line 3 condition. You can see the increased cortical density at the pedicle lamina junction of the L5 vertebra. However, when compared to the cortical density of the L4, L3, and L2 pedicle lamina junctions, it is much less than that of L5. You can see some increased density starting in the L4 vertebra. There's also a clip from a previous surgery. In the L3 vertebra, it looks normal. The same when we look at L2. For the purposes of this video, focus only on the pedicle lamina junction and its cortical density. This patient had a history of endometriosis and a recent hysterectomy. Her chief complaint was pain, or a constant pulling sensation, at area 1, which was determined to be a D fiber major. As you will become aware of in the Mastering the Gut program, a D fiber is a line 3 that is failing to resist and is in need of compensation to maintain homeostasis. The line 3 fiber in this patient was small and not painful to palpation, but felt good when pressure was applied. The D fiber was large, swollen, and painful to touch. Without confirmation at the vertebral level, the D fiber would have been considered the treatment major, which brings up a third observation by Dr. DeJarnette. If the area, line, or vertebral level are incorrect, all treatment is an error. Dr. DeJarnette first mentioned this condition in the 1932 Reflex pain. There was no way for him to validate this observation during the years he practiced. Only with the latest diagnostic imaging and lab testing can his observation be validated. As you can see, this patient suffered from constipation and hip pain, being previously diagnosed with sciatica. This is a line 3 C fiber case. You can see the hypertrophy of the pedicle lamina junction in the L4 vertebra. Once again, it is important to confirm the vertebral indicators to determine the occipital fiber line. Failing to do so would make all treatment an error by diverting the patient's physiologic capacity to heal in the wrong direction. This patient's hip pain was not sciatica in the traditional sense. However, a bone scan and MRI did reveal the source of her hip pain, which correlated to her lab test and was driven by her intestinal inflammation. If you would like more information on occipital fiber analysis and functional organ rehabilitation, you are invited to enroll in the Mastering the Gut program at www.masteringthegut.com.